Hello everyone. Today we will discuss type 1 hypersensitivity reaction. So first just going to what is hypersensitivity. Hypersensitivity is defined as a state of exaggerated immune response to an antigen. Now we must know that every antigen gives an immune response, but hypersensitivity is just a state of exaggerated immune response to that antigen. Now going to the classification. Classification, it is divided into mainly four types. First is the immediate or type 1 hypersensitivity reaction, which we will discuss today. Second is antibody mediated. Third is immune complex mediated. And fourth is T cell mediated hypersensitivity reaction. Now going to the type 1 hypersensitivity reaction. Now, what is it? How we'll define it? It is a rapid immunological reaction, as we can understand from the term immediate, and it occurs in previously sensitized individual that is triggered by binding of that antigen to the IgE antibody on the surface of the mast cell. This definition we will understand when we understand the pathogenesis of type 1 hypersensitivity reaction. Now going to the sequence of events or the pathogenesis. Okay, now we'll understand the pathogenesis. This is an allergen. We can see over here, this is an allergen. There is exposure to an allergen, and this is a mucosal lining. Now this mucosal lining can be any. We can take an example of nasal mucosal lining in case of bronchial asthma. Now this allergen gets expressed to a cell known as dendritic cell, which is an antigen presenting cell, or it can be directly presented to a B cell, B lymphocyte. Now dendritic cell presents it to the naive T cell, and which converts itself into T helper 2 cell. Okay, now T helper 2 cell, or if the allergen directly exposes itself to the B lymphocyte, it causes class switching in the B cell. What is class switching? We can see here are the immunoglobulins which are present on the surface of the B cell. Now, in this case, Th2 helper cell secretes some interleukins like interleukin 4, which leads to conversion of this B cell into IgE secreting B cell. Okay, this is known as class switching. Now, there is production of IgE. This is immunoglobulin E. This immunoglobulin E gets bind to the mast cell on the surface of the mast cell. Such a mast cell which has a IgE bound to it is known as sensitized. This one is sensitized mast cell, and on repeat exposure to that same allergen, now this all part which we were seeing, this one is not necessary. Now on repeat exposure to the allergen, what will happen is this directly binds to the IgE and there is release of the mediators. Okay, now we can understand that this is a type 1 hypersensitivity reaction in which a previously sensitized individual, on exposure to the allergen binds to the IgE which was present on the surface of the mast cell, and there is release of mediators which will give the clinical effects of the type 1 hypersensitivity reaction. Okay, now we will by this you will understand the definition in a much better way. Now there are phases of type 1 hypersensitivity reaction. There is not only the immediate reaction, there is also a late phase reaction. Now what is immediate reaction? It is manifested in minutes and it subsides in few hours. Okay, there is release of mediators from the mast cell. In immediate reaction, the key cell is mast cell, and it releases histamine, leukotrienes, prostaglandins, and the effects are vasodilation, there is increase in vascular permeability, there is bronchoconstriction, there is mucus secretion. These are the immediate reaction phases. Okay, now going to the late reaction phase. Now this is manifested 2 to 24 hours later and can last for several days. The tissue is infiltrated here by inflammatory cells, mainly eosinophils, neutrophils, basophils, monocytes, and T lymphocytes. Here, important cell to remember is eosinophils. And these cells now cause epithelial injury. In the late phase reaction, the main feature will be the epithelial injury. Okay. Now going to the mediators, which will cause the clinical features. Now the mediators are divided into, there are preformed mediators which were preformed in the mast cell granules, and there are mediators which are formed when the antigen allergen binds to it. Now the preformed mediators are three in category. We can divide into three categories. First is the vasoactive amine like histamine. There are enzymes like proteases, acid hydrolases, and their proteoglycans like heparin and chondroitin sulfate. The most important in the preformed mediator, which causes vasodilation, increase in the vascular permeability, is the histamine. We must remember the histamine is mainly responsible for the clinical effects. Now going to the lipid mediators. Now these are uh, formed when the allergen binds to it. These are arachidonic acid derived products, and due to phospholipase A2, it converts the membrane phospholipids into arachidonic acid, from which the leukotrienes and the prostaglandins are then produced. Now these can be leukotrienes, prostaglandins, platelet activating factor. Okay. Now going to the cytokines. These are the mediators which lead to mainly late phase reaction. We understood first also there was an immediate reaction, there was a late phase reaction. The first two preformed mediators and the lipid mediators, they were causing the immediate effect. And the cytokines, they are responsible for the late reaction. They include TNF, interleukin 1, chemokines, and it further amplifies the T helper response and cause epithelial injury. Now, development of allergies, we must know that the susceptibility to type 1 hypersensitivity is genetically determined. And what is atopy? Atopy is there are some individuals which are higher prone to develop immediate hypersensitivity reaction. Such individuals, they have higher serum levels of IgE and more interleukin 4 producing T helper cells. And also we should know that environmental factors are also responsible, but mainly it is genetic. Now clinical manifestations. In this, we will divide the clinical examples into two parts. It can be systemic or it can be local. Now local, firstly understanding the local. Local is reaction to the environmental antigens like pollen, house dust, and the examples can be like urticaria, in which the skin is involved. There can be allergic rhinitis, hay fever, bronchial asthma, and a food allergy. Okay, these are the part of like food allergy, we see peanut allergy. These are the part of local reactions, whereas systemic anaphylaxis is the exaggerated version of local reaction. Okay, in this, the patient will present in a state of shock. The patient can present in a state of anaphylactic shock. There can be widespread edema. There can be breathing difficulty. This is mainly seen due to administration of antisera, drugs like penicillin, any enzymes, and can be seen in some individuals after the bee sting. Okay, these are the examples. This was the type 1 hypersensitivity reaction. Do like and subscribe to my channel and ask any queries regarding the topic. Thank you.